Welcome to Adapting Class. Antilipidemic drugs pharmacology is something that, if you know it, it's good because a lot of people are on these medications. I know everybody know about statins, but recently the NCLEX is asking other questions regarding antilipidemic. That means there's a bunch of medications that you can use for lipids, not statin alone. So you got to have some idea about a couple of them. So this video is designed to teach you some of the key facts. It's just straightforward. I'm not going to waste too much time, give you the facts so that you can answer questions regarding that. So what do you think? Everybody know that what is our medication for? They're going to lower your cholesterol. Number one, uh, there's a bunch of them, and then most of them may lower the lipid in your blood, right? Everybody knows about the statin, like I told you, but there's other that you're supposed to know, other medications that can lower your lipid profile. So they're very, very important. So we're going to take each one of them very short form. So the first one is statins. What did they do? They bind to this enzyme, HMG-CoA reductase inhibitors, right? This is the main enzyme that is involved in cholesterol formation, and this work in the liver. So they go to your liver and do whatever they have to do. Example, I call them Vastin instead of statin, right? Example is Atorvastatin, right? The second one is Simvastatin. You see, he has a last name as Vastatin. Or the another one is Rosuvastatin. The medication go to your liver and do its job. It block cholesterol formation in the night because that's where you make cholesterol, right? Side effect. Okay, your board wants you to know about side effect, muscle pain, myopathy. So you teach the patient to let you know if they have muscle pain or muscle weakness. It can cause liver damage too. So you got to check liver function test or stop any medication that affect your liver. The bad form of muscle damage is rhabdo. So we don't want rhabdo. So that's why when you start having myopathy, we worry about it. Rhabdomyolysis means your muscle is completely dead. The red cells get released. The muscle cramps go to your kidney, block your kidney. So you have liver function, you have kidney issue, you have dark urine, renal failure, hyperkalemia, and muscle pain. Those are all signs and symptoms of rhabdomyolysis. If you just have muscle pain, it's myopathy. But when the kidney is involved, your urine is dark, you have a renal failure, it's called rhabdomyolysis. So what nursing teaching do you tell them? Nursing will monitor LFT, liver function test, probably every 6 months, right? Take the medication at night, right? Very, very important. That's the teaching you take them. So you have to, this is NCLEX classic stage teaching. Take it at night. And then avoid grapefruit juice. This will increase the medication dose. So grapefruit juice, avoid it. It will increase it. It causes toxicity. And then monitor for muscle pain as usual. So this is teaching you provide for a patient taking this medication. That's the first one, starting. This is classic NCLEX question. The next one is usually we call them bile acids. They are bile acids. They usually, example is cholestyramine, and they're going to bind bile acid in your lipids, right? So that's why they're very important. Cholestyramine example is a cholestyramine. So these are examples. So cholestyramine or cholestyramine. These are two medications you should at least know them. They're going to bind to bile acids in the lipids, mostly within the GI tract, right? And it prevents you from absorption. So you don't absorb it. They prevent absorption. Um, they prevent absorption as they bind to it. In the process, they decrease your cholesterol, right? So they decrease your cholesterol in the process. Side effects, you don't have to memorize it. Anything that you take that stay within your GI tract and that's its job there, the side effect will be GI side effect. So mostly GI. So you don't have to worry about it. It causes constipation. Bile acids, it causes bloating. And it causes discomfort, GI discomfort, because it stay there. You slow things down. You absorb all the bile acid and it makes your stool harder, cause constipation, give you bloating and discomfort. So next intervention, you should know if it causes constipation, drink a lot of water, hydration, so that you don't get constipated. And then you take it with meal so that it can pull that bile acid from your food. That's all. This is all you need to know. The next group is fibrates. You may have seen this before. Fibrates are very, very important. Example is Gemfibrozil. So Gemfibrozil, right? This is one of the um, Gemfibrozil. This is one of the medication you should know, or if you know fibrate, because it's very important. Very, very important. Phenofibrate. What did they do mostly? They lower triglyceride. If you want to lower your triglyceride, these are very good. And they will increase your HDL, right? Lower your triglyceride, and they also increase your HDL. What is the side effect of about these medication? Side effect is GI upset, and it also causes myopathy, and it may increase your LFT. The most important thing you should know about this medication cannot combine with statin. You should avoid statin completely. Otherwise, it will make you have rhabdomyolysis as soon as possible. So you want to avoid it. The fibrate, you cannot take it with statin. No way. Next intervention, what do you teach them? Monitor LFTs and avoid, once again, statin. This is good NCLEX question they can ask you. If you take fibrates, you cannot take statin. There's no way. Otherwise, patient is going to have rhabdomyolysis. The next one is nicotinic acid. You know about this. This is what we call niacin. This is vitamin B3. Okay, this is also going to lower your LDL, increase your cholesterol, no, increase your HDL, and then decrease your triglyceride. This also is very good in decreasing your triglyceride. What is the major side effect if you don't know anything about this niacin? Is flushing. It causes a lot of flushing. You can decrease it by taking extended release form. It's very good. It increases your glucose, and then it causes LFT. Your liver function test can get into trouble. There's something you need to know next teaching. So this teaching, this in order to avoid flushing, you should take pre-treatment with aspirin. Aspirin will decrease the flushing, and then take it with food. But because of the major side effect is flushing, you treat the patient with aspirin before they take the medication, and that may help them. The next one is cholesterol inhibitors, right? Absorption inhibitors. We call them cholesterol absorption inhibitors. It prevents you from absorbing. I want you to know this medication, Ezetimibe. This medication, you can combine it with statin. So that is one of the key features. It prevents you from decreased absorption of cholesterol in the GI tract. So that's the main thing. Stay in your GI tract, prevents you from absorption. So most of its side effect is usually diarrhea. It causes diarrhea. It can also cause abdominal pain or discomfort, but it can cause myopathy too. But it's very rare. It hardly does that. And so you teach the patient that they're going to have diarrhea and other thing. You watch for muscle pain and other stuff that they're supposed to know. But know them. Ezetimibe is okay. It's a cholesterol absorbing. You can take it with statin easily. The next one is omega. I will put it here. Omega-3 fatty acids. You've seen it before. Omega-3 fatty acids. This is another medication people take for cholesterol. You see it over the counter. One of them is Lovaza, or Vasipa. This is one of them. What is the problem? The main function is triglyceride. You lower your triglycerides. Key side effect, it has fishy taste. After you take it, it's very fishy. So you take it with milk. So omega-3 fatty acid, it causes GI upset too. There's one key thing I want to leave with you, and Chris may try to trap you with, is this combination. This is combination. Okay. You can combine everything. You can take statin with something, take statin niacin with something, but this combination you should avoid. Statin plus niacin, no, you can't have it. It causes toxicity. It makes you more rhabdo and myopathy. Okay, statin, I already talked about this. Fibrates, you should avoid it. It makes you more toxic and cause rhabdo and muscle pain. Bile acids and then cholesterol absorbing, which is the ezetimibe, will decrease the effectiveness of both drugs. So you should not take them together. These are the no, no, no. Apart from that, any other combination you see on the NCLEX is okay. So statin and niacin cannot come together. Statin and fibrate cannot come together. Bile acid and ezetimibe cannot come together. The two, statin, niacin, statin, fibrate, causes more muscle pain. So you let them watch that they're going to have it. So you try to avoid it, but if you give it to the patient, you have to watch that. You try to avoid it as much as possible. In all of this, okay, don't forget lifestyle modification. You still have to exercise, you still have to change your diet, you still have to do things. You can't just take cholesterol and be eating hamburger every day. You still have to modify your lifestyle to be able to the medication to work. Therefore, these are anti-lipid drugs you need to know. The statins, okay, the bile acids, you have to know omega-3 fatty acid group, the fibrate, Gemfibrozil, the niacin group, and the cholesterol absorbing medication. Thank you for watching and good luck in your exams.